Well, let's go back now to the story we were talking about earlier on, the acute pressures that hospitals in the UK are facing because of COVID. I'm happy to say that we do now have Martin Berry from the College of Paramedics, and he joins us now. Can you just explain how this wave of the pandemic feels to the first wave?
It does feel different. We are seeing a larger number of patients come forward, partly down to the increased number of testing and more people being identified as being COVID positive and accessing the healthcare system because they understand and they know the dangers of the virus. But we're also seeing additional pressures because we haven't yet had to manage this pandemic during what would normally be a very busy time for the healthcare system. And the third factor is that we are not invulnerable ourselves. I've been doing shifts over the last few days, and the number of individuals who are working as paramedics, doctors and nurses who are having to self-isolate or are being tested COVID positive and having to remain at home is having a massive impact on the number of people who are there to respond to patients in need.
And we've heard reports of patients having to be treated in the back of ambulances because there are no spare beds inside some hospitals. Have you ever seen a situation like this during your career with paramedics and the ambulance services?
The only examples I can think of is where I've been involved when we've had to respond to a major incident and there's a short period of time where the system is overloaded over a course of hours, but not over a course of days. This is something quite unprecedented, and it's making us having to make some really difficult and challenging decisions on an hourly basis about how we allocate the precious resources that we have available, and going home at the end of our shift knowing that we weren't able to provide the level of care for everybody that we would normally aspire to do.
Now, the UK's set up backup treatment centres known as Nightingale hospitals. Have they helped ease the pressure, and are they still being used?
They're not being used as to the capacity that I think many people would hope them to be used, and that's part of the problem, in that we can put more beds in, we can put more monitors, we can put more pieces of equipment involved in the care of patients, but the real demand is on the people who are trained to actually use this equipment and care for the patients. It doesn't matter how large your hospital is or how much of an overflow system you have. If you haven't got the people who are there to provide that care, it becomes a little bit redundant and meaningless, and we're struggling to staff the system that we already have, let alone additional services.
Martin Berry joining us here from the UK, the College of Paramedics. Thank you very much for all of your work this year, to you and all of your colleagues.